This information on weight bias internalization has come to light over the past 5 to 10 years. And it's something so important for us to be aware of is not only is it wrong to demonstrate explicit or external bias towards an individual, but we now know that that bias is often internalized in an individual who's receiving that bias. These would be individuals with obesity, because it causes ongoing stress when they're being stigmatized all the time, which towards the left, the first bucket can cause eating and physical activity, change in eating and physical activity behaviors, like actually worsen binge eating and increase caloric intake. The ongoing stress, which we call allostatic load, stress that never goes away, can cause physiological reactivity, increase in cortisol, C-reactive protein, which may lead to a worsening of diabetes as well as blood pressure, and affects healthcare services. If you are stigmatized by a healthcare provider, you're not going to go back and see that healthcare provider because it's called body shaming. So they're going to get less preventive services, less screening like a colonoscopy or a pelvic exam, less blood pressure checks, less often to go see a doctor for diabetes if they're always blamed for their medical problems because of their weight. And that causes ongoing distress psychologically and physiologically and weight gain. So it turns into a vicious circle. So the next time you see a patient with obesity, just think about how they're feeling when they're constantly being berated about their weight. This is called weight bias internalization. Now, I want to end up, Bob, with 2 slides, and these are great recommendations that come from the Rudd Center for Food Policy and Obesity. And these are recommendations for health professionals when you see someone who comes in your office with obesity and you haven't really been thinking about this. You want to consider a patient's previous negative experiences, which are quite common because of other providers they may see. Recognize that having obesity is a product of many factors: genetics, biology, physiology, the built environment, the socioeconomic factors that lead to poor access of good quality food, as an example. Explore all causes of presenting problems, not just body weight. When a patient comes in with a cough or asthma, you don't want first thing out of your mouth shouldn't be, if you weren't overweight so much, your asthma would be better. That's not what they're seeing you for, and they can develop problems that are independent of their weight. Recognize that many patients have tried to lose weight repeatedly. Emphasize the importance of behavior change rather than weight. And this is important. Weight is a outcome. It's a measurement. Weight is not a behavior. So rather than just saying, I want you to lose weight, you want to say, I'd like you to eat healthier, choose healthier foods, get more physical activity. And the outcome of that is losing weight. You don't just lose weight as a behavior. Acknowledge the difficulty making lifestyle changes. It's very hard. There's a lot of inertia in making changes, a lot of obstacles. People are often ambivalent about making changes. And lastly, recognize that small weight losses can improve health. And Bob, this is the very last slide, and I want to also end on this. These are recommendations for health professionals, questions you can ask yourself to identify your own attitudes. And trust me, we all have attitudes and implicit bias when it comes to a lot of health issues. Obesity is among them. And I just want to read these to you as I end up, because I think they're very important for you to be asking yourself. Number 1, do I make assumptions on weight regarding character, intelligence, professional success, health status, or life behaviors? Am I comfortable working with people of all shapes and sizes? Do I give appropriate feedback to encourage healthful behavior change? Am I sensitive to the needs and concerns of individuals with obesity? And lastly, do I treat the individual or only the condition? So